Jumanu la mutatapu asiti kutia fabakiba. Mkumulu jamanu la mutatapu asiti kutia fabaki. Mama janke wali ngana. Bada bandula lunde nyanjo. Bada bandula lunde nyanjo.
Good morning, everyone, and thank you so much for your patience. Welcome to Central Hall, Westminster for the London School of Hygiene and Tropical Medicine's graduation ceremony. The ceremony will begin very shortly, but just before it does, I need to make a few housekeeping announcements, so if you could all please take your seats. Firstly, can you please make sure that all your mobile phones and any other electronic devices are turned to silent? Graduands, please ensure you are sitting in the seat assigned to you. You will find your seat number on your e-ticket. We aren't expecting any problems today, but if for any reason we need you to evacuate the hall, an alarm will sound and ushers will guide you through the doors to a safe place. Please do have a look around now to familiarize yourself with the exits, as there are many throughout the hall. You will notice there are some video cameras around the rooms today. This is because the ceremony is being live streamed and it will be available for download afterwards. Please also be aware that flash photography will be used as each graduate crosses the stage. Do feel free to take photographs and videos throughout the ceremony. Just please take sure not to obscure the view of anyone else around you. Finally, today is a celebration of the success of our graduates. So please do enjoy the morning and show your support with applause and maybe even a little cheer. Now, if people wish to and are able to stand, please rise for the procession party.
Good morning, everyone, and a very warm welcome to the London School of Hygiene and Tropical Medicine's graduation ceremony 2025. It's wonderful to see such a large number of family and friends here to celebrate our graduates' achievements. It's my pleasure to introduce our Chair of Council, Don Robert, who will introduce this year's Greenwood Africa Award.
Good morning, everyone, and let me add my welcome to our graduates, their families, and friends on this very, very exciting and special day. This morning, it's my special pleasure to give the citation for the Greenwood Africa Award, which will be awarded to Dr. Fitsum Tedessa. This award recognizes a mid-career African scientist who shows exceptional promise as a research leader. Trained in biochemistry and molecular biology in Ethiopia, the Netherlands, and Norway, Dr. Tedessa obtained his PhD with honors from Radboud University in the Netherlands in 2021. This predicate is only given if a thesis is judged to be of outstanding by two independent committees of experts, and places his thesis in public defense among the top 3% across Dutch universities. Affiliated to the Armauer Hansen Research Institute in Addis Ababa, he focuses on translational research to support malaria elimination in the Horn of Africa. This region is disproportionately affected by the emergence of parasites with a genetic mutation known as histidine-rich protein 2 deletions, partial resistance to artemisinin drugs, invasive Anopheles stephensi mosquitoes, and high prevalence of the PVVAX malaria parasite. Dr. Tedessa addresses all of these challenges in his multidisciplinary approach with an outstanding team in Ethiopia. Remarkably, there was very little malaria research at the Institute when he started his work. Dr. Tedessa has truly changed this and made it an influential malaria center of excellence. Dr. Tedessa is an internationally recognized emerging leader, much respected mid-career professional, and successful mentor to the next generation of researchers. In recognition of his excellence, Dr. Tedessa received the 2022 Alan J. McGill Fellowship from the American Society of Tropical Medicine and Hygiene, the Radboud Institute for Health Sciences Societal Impact Award in 2021, and the Rising Star Award from the Gates Foundation in 2019. Dr. Tedessa recently demonstrated the very high permissiveness for Plasmodium infections of invasive Anopheles stephensi mosquitoes. He conducted a unique investigation that drew evidence from entomology, epidemiology, and genomic methods to convincingly demonstrate the association between an upsurge of malaria and Anopheles invasion in Dire Dawa. His work, published in Nature Medicine, illustrates the unique breadth and evident excellence of his work, supported by previous evidence that he gathered in meetings with international stakeholders that he organized. This work culminated in the development and adoption of a 5-year Anopheles stephensi action plan for the Ethiopian government and neighboring countries. With his inspiring enthusiasm and work ethic, he is addressing diagnostic resistance in a similar multidisciplinary and policy-focused manner. Dr. Tedessa's findings from a large multi-site study on histidine-rich protein 2 and 3 deletions played an important role in the recent decision of the Ethiopian Ministry of Health to switch to alternative rapid diagnostic tests. With these achievements, the work and charismatic leadership of Dr. Tedessa has already had a direct and positive impact on health policy in 2 important fields of malaria control: an impact that is admirable and one that many senior colleagues can be slightly jealous of. And the list of achievements does not end here. I should also mention the recent establishment of the Ethiopian Malaria Genomic Epidemiology Network, where Dr. Tedesse forged new collaborations between Ethiopian institutions and brings novel and much-needed technologies and human capital for genomic epidemiology to Ethiopia. In summary, Dr. Tedesse is an outstanding, energetic, charismatic, mid-career research leader who is building bridges between outstanding researchers from endemic settings and international collaborators, and between academia and policy. Dr. Tedesse, it gives me great pleasure to call the director of the school, Professor Liam Smith, to confer upon you the Greenwood Africa Award of the London School of Hygiene and Tropical Medicine.
Honored guests, colleagues, and friends, dear graduates and families. I'm deeply honored to accept the Brian Greenwood Africa Award. This award is not just a recognition of my work, but a tribute to countless researchers with whom I enjoyed working, healthcare workers and colleagues striving to improve healthcare in Africa. Science is a collective effort, and I stand here today because of mentors who guided me and communities who entrusted us with their health. This award strengthens my resolve to push the boundaries of research so that decision is made based on locally generated and quality evidence. Thank you to the London School of Hygiene and Tropical Medicine for recognizing my work, my mentors who supported me and who also nominated me for this award, and funders who put their trust on me, and my team at home and here at London School, and also my family, my beautiful wife, Sarina, and my children, Barcote and Rodas, 12 and 10 years old. They are among the guests here for inspiration all the way from Addis. This is our shared achievement, and the journey continues. Thank you very much.
Thank you so much for sharing those words. It's now my great pleasure to introduce Dr. Karina Rando as our guest speaker for today. Dr. Rando is an alumna of the London School of Hygiene and Tropical Medicine and is currently the Minister of Health for Uruguay. I warmly welcome you to the stage, Dr. Rando.
Director Professor Liam Smith, authorities and teachers of LSHTM University and other universities, graduated students and their families, ladies and gentlemen, good morning, and thank you for the honor of being part of this ceremony. Steve Jobs once said, "If you have a dream, protect it." To that, I would add, prepare yourself to fulfill it. I'm from Uruguay, a small democratic South American country with a population of 3.4 million people. My family was middle class, and with significant effort and sacrifice, they sent me to a bilingual school, Spanish and English, to, as my parents would say, prepare for the future. While I was fortunate to have this opportunity as a child, I didn't always appreciate my circumstances. For instance, I didn't like to eat vegetables or meat. My mother would scold me for this, telling me that there were places where children didn't have food to eat. Perhaps that's why I grew up perceiving the world as an unfair place. I aspired to help children who lacked the opportunities I had. I dreamed of being able to make decisions that would make a difference for the most unfortunate people. As a teenager, I chose to study medicine because it is a service profession. However, I lacked a clear idea of how I would become a decision maker, given that I have no connection with politicians, hospital directors, or influential people. Once I began my clinical practice, my dream seems to drift farther away, and my medical specialty, anesthesiology, consumed me almost entire for 2 decades. With my team, I dedicate myself to establish and refining the liver transplant program at the National Hospital of the Armed Forces in Uruguay. I also joined the University of the Republic as an associated professor of pathophysiology, anesthesiology, and biomedical engineering, publishing more than 50 scientific papers. Despite that accomplishment, I had not been able to influence decision-making on health policies or social policies at the national level to reduce inequities. Therefore, at 46 years old, with my children grown and the transplant program running smoothly, I decided to prepare for my next step. What it was, I didn't know exactly, but I was clear that I hadn't achieved my dream yet. I decided to expand my academic training. Since Uruguay lacked a master program in public health, I chose the London School of Hygiene and Tropical Medicine. My prior English studies were crucial for my acceptance. However, during the first month, I understood only 40% of the classes and had to listen to recordings several times in my student residence to understand them. My classmates, much younger than me, learned more easily. Many days I cried and I wanted to give up. Gradually, I improved my learning and graduated with good grades. After returning to Uruguay, I presented my newly acquired public health degree to General Manini Rios, former director of the Armed Forces Hospital, to offer my support to a new political party, Cabildo Abierto, founded in 2018. In 2019 national elections, this party became part of the government coalition and was entrusted with the Public Health Ministry. I was invited to join them. I assumed the role of General Director of the Ministry on March 2, 2020. 11 days later, Uruguay reported its first COVID-19 case. I led the national conducted trace pandemic response, overseeing 19 teams with more than 300 people who conducted tracing, testing, and isolation of cases. We analyzed each step of the health contingency and appealed to citizens' sense of responsible freedom, avoiding a national lockdown. We reorganized the health system into a public-private cooperation, ensuring that it never collapsed. And every patient requiring medical attention, including ICU, received it. Before this experience, I hadn't imagined applying the knowledge I'd gained at LSHTM. I utilized concepts like positive externalities in vaccination plans, opportunity cost, and many others that allowed Uruguay to become one of the most successful countries in management of the pandemic, avoiding hundreds of deaths. Additionally, when other nations refused to allow ships with COVID-positive passengers to enter their ports, Uruguay received the Greg Mortimer, an Australian cruise ship with more than 100 infected individuals. I organized the rescue mission, including the medical assistance on board, the disembarkation, and the land assistance of passengers and crew. Only one patient succumbed in the ICU. Post-pandemic, as a Minister of Public Health, I led the implementation of Latin Americans' most advanced cervical cancer screening program with HPV testing, as well as vaccination initiatives for children and youth. We implemented policies to combat overweight, based on what I learned about public health problems at LSHTM. We also organized the most comprehensive program for mental health improvement ever carried out in Uruguay. Through these and other public policies, we implemented cost-effective treatments, advancing equity and access to health for thousands. It was then I realized my dream had finally been fulfilled. I extend my gratitude to LSHTM for enhancing the chances of making my dreams come true. Based on my experience, I urge you not to abandon your dreams. Be persistent and ready to seize opportunities as they arise. Remember, when challenges emerge, you can overcome them. Hard is the way. Beat it. Thank you.
Thank you so much for that inspiring speech, Dr. Rando. I would now like to invite the President of the Student Representative Council, Hamza van der Ros, to the lectern.
Honored guests, friends, family, graduates. It is an honor to stand before you today as we celebrate the end of our academic journey together and the start of our new chapters. We step into a world that feels increasingly uncertain, a world in which key global health initiatives have suddenly been affected by shifting support, and where ongoing humanitarian crises in places like Gaza and Sudan underscore just how urgently our voices and expertise are needed. And yet, if my year at LSHTM has taught me anything, it is that we are a resourceful bunch, and we can make the most out of any situation. Amidst the bustle of London life, our intensive schedule, getting lost in the lower ground floor, the hours spent in the library to the soundtrack of drilling and renovations, we managed to create something more valuable than just a degree from a world-class institution. A community that thrives on diversity, humor, a shared vision for global health equity, and a few slices of pizza. As Paul Farmer, a pioneering global health advocate, once said, all of your most important achievements will come from working with others. In a word, partnership. During our time together at LSHTM, we witnessed firsthand that this is true. Today, we join a legacy of LSHTM alumni who have played roles great and small in shaping global health. Whether you are headed to the WHO headquarters in Geneva, a remote clinic in the Gambia, the research labs, or are still figuring it out, I hope that you carry the tools, knowledge, and collaborative spirit to make a difference. Congratulations, class of 2024.
Thank you very much, Hamza. We now come to the presentation of today's graduates. On behalf of the London School of Hygiene and Tropical Medicine, we invite the programme directors to formally recognise and celebrate the academic achievements of our students. Representatives from each faculty will present to you the the master's and doctoral degree students who qualified for a degree. I call upon Professor Elizabeth Allen to come forward and present the master's and doctoral degree graduates from the Faculty of Epidemiology and Population Health.
Good morning. It's my pleasure to introduce the master's and doctoral graduates from the Faculty of Epidemiology and Population Health. I call upon Mr. Edward Stanhope and Dr. Charles Apondo, Programme Directors for Clinical Trials by Distance Learning, to come forward. For the award of Postgraduate Diploma Clinical Trials by Distance Learning, with distinction, Eleanor Damien. For the award of Master of Science Clinical Trials by Distance Learning, with distinction, Frank Hanses. With distinction, Philip Karshnier. With distinction, Jose Paulo Panuda. With distinction, Carlos Nicolas Perez Garcia. With distinction, Nico Tesken. With distinction, Kane Withers Stewart. Mike Franchetti. Lam Hong Bao Ngok. I call upon Dr. Pauline Shelbeek, Programme Director of Master of Science, Climate Change and Planetary Health, to come forward. Abigail Hartog. I call upon Dr. Sarah Walters, Programme Director of Master of Science, Demography and Health, to come forward. Daniel Pereira Mia Fernandez. I call upon Dr. Ona McCarthy and Dr. Patrick Ngwipdok Jomo, Programme Directors for Master of Science Epidemiology, to come forward. The Adrian Root Prize, Khalif Yusuf. The Nandlal Bajaj and Savitri Devi Prize, with distinction, Leela Goodwin. With distinction, Chan Bo Ying. With distinction, Sarah Dixon. With distinction, Julia Edgar. Jabir Ali Abdullahi. Raja Ahmed. Titilope Akinola. Rebecca Anderson. Guste Stefania Babicevatu. Habibatu Neneba. Tao Cohen. Trish Ding. Yasmin El Rakawi. Theodoros Philippou. Eleonora Giordano. Han Han. Ines Jimenez. Hannah McGregor. Kausa Mossini. Catherine Morrow. Polly Nightingale. Terapa Newes Wiwat. Ellen Silver. Jacopo Vecchio. Yuzhang Chong. Tali Yawich. I call upon Dr. Annabelle Gourlay and Dr. Laura Oakley, Programme Directors, Epidemiology by Distance Learning, to come forward. Joanna Ansulatu. Sorry, the postgraduate certificate in distance learning. For the award of postgraduate diploma epidemiology by distance learning, Donny Patel. For the award Master of Science epidemiology by distance learning, the University of London Achievement Awards with distinction, Marco Chow. With distinction, Daniel Alejandro Queremel Milani. With distinction, Maria Laura Tupas. Mohammed Ali Magan. Kelly Bogart. Theon Carlin. Ayana Critchlow. Andrea Gosse. Amon Hoffman. Benson Izaro. Xingchen Lai. Zoe Leftley. Katia Nazizi. Diane Nuales Percy. Simran Kaur Mangat Panda. Sara Siavashi. Malgozala Starchevska. Christian Tylaker. Ishiro Watanabe. Anta Wind. I call upon Professor Liam Smeeth, Director of London School of Hygiene and Tropical Medicine. For the award of Master of Science, Global Mental Health. The Chismal Sirwadana Prize, with distinction, Daniel Stanyan. With distinction, Maria Jose Alpuche de Lille. With distinction, Mariam Faraha Amjad. With distinction, Jaya Katia. With distinction, Pranithi Ramachandra. With distinction, Hannah Tu. With distinction, Yuting U. Amal Saleh Al-Akili. Ella Aslin. Lin Chung. Amelia de Serpa Pimenta. Karen Dupont Falcon. Barira Gaffa. Ida Kari. Wei In U. Aisha Galia Safinayu. Pial Saka. Rula Sevrukaite. Renata Teixeira da Silva. Fatima Wayne. Yin Zhou. I call upon Dr. Stefan Huet, Program Director for Master of Science, Health, Data Science. With distinction, Su Hut An. Uchenna Agu. Lana Amir Hawezi. Wan Jen Lee. Patricia Liu. Hao Kai Zeng. Humza Fandaros. Yiting Yu. Kit Ying Yuan. I call upon Dr. Melissa Neumann, Programme Director for Master of Science Medical Statistics, to come forward. For the award of Master of Science in Medical Statistics, the PSI Andrew Hewitt Prize, with distinction, Isabel Landry. With distinction, Barnaby Akenzua Sanderson. With distinction, Annabelle Luke. With distinction, David Ryan. With distinction, Alexandra Sabota. With distinction, Katrina Spenceley. With distinction, Ka Wing Tam. Hannah Bailey. Samuel Henshaw Alcock. Lucia Poyatos Boehner. Laura Reed. Adrija Shaha. Jamari Webley. I call upon Dr. Hilary Davis Kershaw, Programme Director of Master of Science Nutrition for Global Health. For the award of Master of Science Nutrition for Global Health, the Hecht Bequest Prize, Katie Fulford. The John Rivers Prize, Lucretia Caselli. The John Rivers Prize, Holly Sweet. With distinction, Ho Ying Edwina C. Ashlyn Anderson. Michele Granata. Claudia Hobbs. Scarlett Scott. Isha Shinde. Alex Tunkuda. I call upon Dr. Melissa Palmer, Programme Director, Master of Science, Reproductive and Sexual Health Research. For the award of Master of Science, Reproductive and Sexual Health Research, with distinction, Sally Ray Atta. With distinction, Rino Nishida. With distinction, Adishre Sunil Kumar. With distinction, Erin Voss. Daisy Green. Tabitha Griffiths. Annie Heath. Rikako Iwanaga. Julia Kelly. Jamie Yinman Lam. Sabrina Lee. Wada Demo. Thomas Pedavia. Nura Yan Hao Yip. I call upon Dr. Chidos Visa Chikwari, Dr. Deda Ogum, and Dr. Rachel Scott, Programme Directors of Master of Science, Sexual and Reproductive Health Policy and Programming, to come forward. Pauline Gartle. Makeen Hope. Amanda Nanmo. Lillian Nkonge. Nkobile Sazabedze Maibi. I call upon Dr. Ellen Fragassi, Programme Director of Master of Science, Veterinary Epidemiology, to come forward. For the award of Master of Science, Veterinary Epidemiology, Azin Abbasium. Natasha Isabel Koppel. Xavier Dunn. Wisal El Majoub Benza. Maria Fernanda Faria Espituca. I call upon Dr. Sam Ashford, Joint Head of Doctoral College, to come forward. For the award of PhD Epidemiology and Population Health, the Cicely Williams Prize, Ursula Gazali. Advances in the conceptualization and measurement of maternal mortality and morbidity. Aishatu Adamu, assessing the impact of a 10-valent pneumococcal conjugate vaccine, PCV10, in the absence of pneumococcal disease surveillance data in Nigeria. Megan Irene Ausenberg, mathematical and statistical modelling to inform polio and measles vaccination programming. Patrick Brian Bidulka, advancing the use of routinely collected health data in observational research to study comparative treatment effects, 2 natural experiments in UK primary and secondary care. Steady Jerome Dixon Chaisimpa, breast cancer in women living with HIV in sub-Saharan Africa, presentation, diagnosis and survival. Faye Cleary, challenges of studying and predicting chronic kidney disease progression and its complications using routinely collected electronic healthcare records. Asmay Dukani, a mixed methods evaluation of the Working Alliance in a blended cognitive behavioural therapy intervention for depression in a multinational randomised controlled trial in Europe. Kate Elizabeth Edgar, admission avoidance hospital at home, extending understanding using trial and observational data. Sue Hudson, beyond breast density, novel uses of automated mammographic analysis in breast cancer screening. Robert Campbell Hughes, caring for young children living in informal settlements in Nairobi during the COVID-19 pandemic. Suzanne Keddy, latent class models for diagnostic test accuracy with application to fever etiology. Andriana Kostaraki, comparison of causal inference methods for observational data with a hierarchical structure. Julian Matthewman, efficient organisation and valid phenotypes in electronic health records research, applied examples relating to atopic eczema and other inflammatory diseases. Mary Wangeshi Mbao, community participation in the maternal and perinatal death surveillance and response, MPDSR in Kenya. Caroline Mburu, the utility of mathematical modelling of serological data in assessing the impact of vaccination programs in Kenya. Anna Afriye Mensa Abrampa, Counting the Invisible Health System Factors Influencing Stillbirth Measurement and Reporting. Shamsuddin Mohammed, Effect of Breastfeeding Duration on Education and Attainment of Children and Adolescents in Sub-Saharan Africa, a multi-state analysis of longitudinal data. Lisa Montel, Assessing the Implementation of the Right to Health Through Indicators, an interdisciplinary effort applied to breast cancer. Rebecca Eliana Penzius, Service Readiness for Inpatient Small and Sick Newborn Care, Development of a Novel Standardized Health Facility Assessment Tool and Evaluation in 64 hospitals in Kenya, Malawi, Nigeria, and Tanzania. Ruan Rutnayake, Case Area Targeted Intervention for the Control of Cholera Epidemics in Crises, from Spatial Mathematical Modeling to Field Evaluation. Veronica Reichenberger, Using in-depth interviews and participatory visual methodologies to investigate healthcare access among adults with disabilities in Brazil. Dane Rodriguez Gata, Access to Healthcare Among People with Disabilities in Chile. Grace Ryan, Involving People with Lived Experience in the Evaluation of a Mental Health Peer Support Project in Uganda. Fanny Sandalinas, Understanding the Impact of Malaria on the Interpretation of Micronutrient Biomarkers. Anne-Marie Zeffel, The Association Between Maternal Mental Health and Vaccination Uptake and Timeliness During Early Childhood. Emma Teo, Real-World Effectiveness of Oral Anticoagulants in the Prevention of Stroke, Emulation and Extension of the Aristotle Trial using UK EHRs. Kevin van Zandvoort, Strategies for Pneumococcal Conjugate Vaccine Use in Humanitarian Crises. Arti Vansanthurupan, Economic Evaluation Methods for HIV Testing of Children and Adolescents in Zimbabwe. Ogunebrume Wariri, Timeliness of Routine Childhood Vaccinations in the Gambia, Examining the Burden, Spatial Pattern, Determinants and the Impact of COVID-19 Pandemic. For the award of PhD Epidemiology and Population Health, Nagasaki, Su Mat Han, Unraveling Transmission Dynamics of Influenza and its Interaction with Other Respiratory Viral Pathogens in the Population of Kamigoto Island, Japan. Zaina Jamildine, establishing a Palestinian refugee birth cohort using electronic health records to investigate the effects of size at birth on child well-being. Tomoka Nakamura, investigating social contact patterns and their role in transmission dynamics during the COVID-19 pandemic in Japan. For the award of PhD by publication, Epidemiology and Population Health, Julian Eaton, access to mental health services informing efforts to close the mental health treatment gap. Amelia Exare-Zaku, inequalities in cancer care in England from diagnosis to treatment. Nathaniel Shearer, the mental health and well-being of children with disabilities. Catherine Sherratt, collaborative outbreak modelling for decision support, evaluating trade-offs from multi-model combination. For the award of Doctor of Public Health, Epidemiology and Population Health, Philip Shepherd, the experiences of older persons with disabilities in humanitarian crises in eastern Ukraine and western Tanzania. Emma Radovich, complex reality implementation and measurement, evaluation of an electronic decision to support systems to improve antenatal care quality in South Asia. And that concludes the awards to the master's and doctoral graduates from the Faculty of Epidemiology and Population Health.
Thank you, Professor Elizabeth Allen, and many congratulations to all of you who've just crossed the stage. I now call upon Professor Alison Grant to present the master's and doctoral degree students from the Faculty of Infectious and Tropical Diseases.
Good morning. It's my pleasure to introduce the master's and doctoral graduates from the Faculty of Infectious and Tropical Diseases. I call upon Dr. Anita Skinner, Programme Director of the Master of Sciences in Infectious Diseases by Distance Learning, to come forward. For the award of Postgraduate Certificate in Infectious Diseases by Distance Learning, Mojisola Ajinai. Hakan Ayaz. For the award of Master of Science in Infectious Diseases by Distance Learning, winner of the Martin Taylor Prize, Kawela Mumba. Adam Al-Hakim. Alexandra Allard. Michele Baldini. Roisin Burrows O'Donoghue. Peter Conlon. Maria Alessandra De Bono. Almudena Fernandez Merino. Sharon Hughes. Helen Jameson. Mahera Kamran. Melissa Ann McLaughlin. Edil Osman. Charlotte Tadera. Mizinga Tembo. Minal Ahuja Upal. Sarah Vella. Jessica Walker. Erin Williams. Essie Weiner. Dominic Workue. I call upon Helena Helmby, Programme Director of Master of Science in Immunology and Infectious Diseases, to come forward. For the award of Master of Science in Immunology and Infectious Diseases, winner of the Michael Stewart Prize and awarded with distinction, Fong King Song Brian. Awarded with distinction, Josephine Lutke Birding. Maxence Julian Boggio. David Campana Cancino. Naomi Mara Claro d'Oliveira. Marie Isabelle Couturier. Victoria Hayro. Ngai Ki-ho. Haning T.S. Alifin Jasmine. Henry Ng. Jessica Peter. Wilfred Jin Sheck. I call upon Dr. Richard Stabler, Programme Director of Master of Science in Medical Microbiology, to come forward. For the award of Master of Science in Medical Microbiology, winner of the Beau-Drazar Prize and the Sequet Prize, and awarded with distinction, Matt Harvey. Steady. Zoe Collier-Headley. Daniel Thomas James Denton. Li Yingying Crystal. Wei Chio Ma. Sophie Mallinson. Nanthini Ramanathan. Victoria Rangalova. Alice Ringelstetter. Sophie Wickham. I call upon Dr. Matthew Rogers, Programme Director of the Master of Science in Medical Parasitology, to come forward. For the award of Master of Science in Medical Parasitology, winner of the Patrick Buxton Memorial Prize and passed with distinction, Samuel Palmer. Winner of the James Busvin Memorial Prize, Ernest Chin Jia Bin. Also winner of the James Busvin Memorial Prize, Bethany Perry. Charlotte Berry. Michaela Bikarova. Naoki Matoba. Ruben Moskies. Alexandra Hoga. I call upon Dr. Pablo Alarcon, the Programme Director of the Master of Science in One Health, Ecosystems, Humans and Animals, to come forward. For the award of Master of Science in One Health, Ecosystems, Humans and Animals, passed with distinction, Rhiann Davis. Passed with distinction, Laura Amy Rutter. Isabel Ollett. Samuel Cohen. Ava Drake. Yalis Engom. Maria Fernanda Riso. Angel Sodi. Madeline St. John. Faye Watson. Aidan Winters. I call upon Dr. John Buchan, the Programme Director for the Master of Science in Public Health for Eye Care, to come forward. For the award of Master of Science in Public Health for Eye Care, Anwar Ahmed. Sahini Dez. Veronica Akai-Eti. Fong Kilok. Leon Kayao. Haris Mahmood. Zohar Mian. Itiafa Njinaka. Prathiba Obed. Rundaben Patel. Caitlin Santana. Marina Akiko Shiroma. Tam Natalie Arman. ZQ Imen 1. Chun Hing Yung. I call upon Professor Robin Bailey, Programme Director of Master of Science in Tropical Medicine and International Health, to come forward. For the award of Master of Science in Tropical Medicine and International Health, winner of the Frederick Murgatroyd Award and awarded with distinction, Rosemary Ho. Awarded with distinction, Megha Anil. Awarded with distinction, Andrea James Lopez. Awarded with distinction, Tom Spears. Mirna Abd El Aziz. Charlotte Bestwick. Benedetta Cornelli. Maud Fleury. Suna Hussain. Rachel Healy. May Tep Nwai. Flora Olcott. Monica Pacha. I call upon Dr. Sam Alsford, Joint Head of Doctoral College, to come forward. For the award of PhD in Infectious and Tropical Diseases and winner of the Garnham Prize, Lynn Van Heer. I forgot to say the name of your PhD. You're going to have to stand there while I say it. I'm really sorry. Transmissibility and antimalarial resistance in human malaria parasite Plasmodium falciparum in Mali. Holly Ackford-Palmer, a genomic investigation into 3 malaria vectors, Anopheles darlingi, Anopheles fenestus, and Anopheles stevensi. Kasim Alel Henriquez, impacts of antimicrobial resistance bloodstream infections among hospital patients and potential interventions, a case study in Chile. Mike Chaponda, reducing the burden of malaria and curable sexually transmitted and reproductive tract infections during pregnancy in an area of high co-infection. Emma Collins, utilising genomic approaches to explore genetic diversity and insecticide resistance in Aedes aegypti populations. Kate Gaskell, respiratory pathogen transmission among exposed household contacts. Georgia Gore-Langton, malaria and curable sexually transmitted and reproductive tract infections in pregnancy, a dual burden of disease and challenge for the antenatal care package. Eunisa Wavinja Kiamba, characterization of B-cell and T follicular helper cell responses to HPV vaccination, the effect of age and dose number on the vaccine immunogenicity. Harry Langston, study of the determinants of enteric neuropathy in experimental Chagas disease. Victoria Mieri, understanding the role of the pharynx as a driver for antimicrobial resistance in Neisseria gonorrhoeae. Sophie Moss, genomic epidemiology of Plasmodium falciparum and its anopheline vectors in the context of malaria control on the Bajajos archipelago of Guinea-Bissau. Neve Sarah Gabrielle Murphy, development of rapid diagnostic tests for Trypanosoma cruzi lineage-specific serology, comparative epidemiology, and for monitoring efficacy of chemotherapy. Esin Nkuruem, evaluating the sequelae of pulmonary tuberculosis in Gambian children and adolescents. Mwelwa Muleba Piri, assessing the implementation of an innovative community-based peer-led intervention and its impact on coverage of sexual and reproductive health services among adolescents and young people aged 15 to 24 years in Lusaka, Zambia. Frederick Sarath Chandra, bug beats, understanding wing beat frequency for automated detection of mosquitoes. Kristina Vasilova, biochemical and bioinformatic characterization of understudied erythrocyte surface-expressed hypervariable protein families in Plasmodium falciparum. James Milburn, strategies to improve the diagnosis of central nervous system infections in high HIV prevalence African settings. For the award of PhD in infectious and tropical diseases, Nagasaki, Maria Lourdes Macapaga Macalinao, investigating the generation and maintenance of immunological memory to malaria infection. Daniela Mano for the award of PhD by publication in infectious and tropical diseases, testing a prophylactic vaccine regimen against Ebola virus disease in Sierra Leone, vaccine safety, immunogenicity, and factors affecting immunogenicity. Hope Simpson, strengthening the collection, interpretation, and use of data to target expansion and integration of case detection and management interventions against neglected tropical diseases. And that concludes the awards of the Masters and Doctoral graduates from the Faculty of Infectious and Tropical Diseases.
Thank you very much, Professor Alison Grant, and a very big congratulations to all of our graduates. I now invite the school's director, Professor Liam Smeeth, to give his closing address.
Thank you, Ahmed, and thank you, everyone. We're on the home stretch. I'll only be an hour or two, so if you want to have a stretch or a stand-up or a cough, now is the moment. It's quite hard to hear behind me, a little bit hard to hear behind me, so I'll just summarize for the people here, which is the world's facing lots of challenges, but we're going to be okay because we've got this lot. But I will expand a little. So I'm going to base the talk on just 5 words. Don't get your hopes up, there's some explaining. So it's pride, compassion, self-care, wisdom, and integrity. And I'll start with how enormously proud I am. And I'll go to a different dictionary definition. It's a deep sense of happiness and satisfaction as a result of the achievements of others with whom you're closely associated. So that's you with the achievements, and us and your friends and families with all the pride and happiness. And it really is a happy day. Proud of you all. I know you are proud of each other. And I know people are very proud of you, so you really should indeed be proud of yourselves. And I'm going to come back to pride at the end. You don't need me to tell you the world's facing many challenges. Conflict, pandemics, rising costs, growing poverty and inequities, misinformation, the daily norm, and climate change is threatening the planet. And added to this, in many settings, is a political leadership that doesn't value equity, and isn't prioritizing the alleviation of human suffering. And health is a really key element to all these challenges. Health is fundamental to human resilience, our ability for people to deal with what is thrown at them. And it's also central to human happiness and fulfillment. So it is a privilege to have as our jobs to work in health and in trying to improve health. But it's not always easy. You'll face many struggles, disappointments in your careers, and these happen. When you look at my own CV, you see this sort of steady trajectory of jobs obtained and grants got and things here and things went well there. And all the disappointments and all the things that didn't work out well are completely invisible. And there was no plan. There was no plan at all. Early on, I wasn't allowed into medical school. People from my background didn't go to medical school in those days, didn't even go to university in those days. Things have improved a little bit, and certainly people are getting more opportunities, but still a lot of challenges being faced by people, and I know many of you will face discrimination and inequities throughout your lives and have already. So try not to let the struggles and disappointments get you down, or let them get you down a bit, because you do have to be human. But do try and stay steady. So back to those 5 words I was talking about: pride, compassion, self-care, wisdom, and integrity. And I was recently in South India, and written on a wall was a slogan, "Strive to do the right thing." And I thought, well, that does it, that sums it up. That sums up everything I kind of believe in, I guess. But it can be difficult to know not just doing the right thing, but knowing what the right thing is to do. And that's where I think these 5 elements come in. So I'll come back to pride. But bring compassion, the wish that living beings do not suffer, and the urge to do something to alleviate and prevent that suffering. And this compassion needs to include self-care, something it's easy to neglect when one's working in health. And I think to help and support others, whether it's at the scale of millions of people through public health initiatives, whether it's at the individual level, with friends, with patients, with colleagues, with families, even with random strangers, we need to be at our best to be best placed to help others. And that self-care really matters, and it isn't about being selfish and self-centered. It's about accepting that looking after yourself is a part of you being able to contribute to a better world. So be compassionate, look after yourselves. And then comes wisdom. And for me, wisdom is about using your knowledge and experience to make the best decisions and judgments you can. You won't get everything right, but use your experience and your skills and knowledge to make the best decisions you can. So be compassionate, look after yourselves, and bring wisdom. But there's more. There's integrity. And here's another dictionary definition. This is from a children's dictionary. Integrity is doing the right thing even when no one else is watching. And it's about being honest and taking responsibility. It's about having a strong moral compass. And of course, people's morals and values differ, so you need to find your own way forward. And I would bring you back to compassion and that wish that others do not suffer, and the wish and the urge to alleviate that suffering, and bring you back to wisdom, using everything you know and everything you've learned. So finally, that brings us back to pride. And do take this moment to be proud of what you've achieved through your studies. And look forward decades into the future. And be able to look back on your life with pride. Let your actions and words and behaviors, right down to the thousands of tiny moments that happen every day, be actions and words and behaviors that you can be proud of. As I said, the world's facing many challenges, and many of them impact on human health, but I do have hope and I have faith, and that's because of you. It's the energy and the commitment and the desire I see for a better world coming from that next generation. I realize not all of you are chronologically young, but I think you're young at heart, you want things to be better, and you're young at heart helped by a life of learning. I know you're ready to take on those challenges. So we hold our communities, indeed we hold our very planet in trust for the next generation. So there's no pressure, but the world really does need you. Keep in touch with each other, keep in touch with LSHTM. And another thing we need right now is supportive communities, perhaps more than ever. So be compassionate, remember to look after yourself, bring wisdom, have integrity, and remain proud and be proud. Keep going, and keep going in ways that you know you can be proud of. Thank you.
Thank you so much for those words, Liam. It's now my pleasure to close the ceremony by inviting you all to join us for a celebration with light refreshments in the lecture hall and library. There'll be staff on hand to direct you. Thank you so much for coming today to share in the celebrations. If you're willing and able to stand up, then please do so now for the recession.
24.